This is grade 4 gynecomastia with double mastectomy and free nipple areolar grafts. Good morning guys, today we're doing grade 4 gynecomastia surgery. Now, this is one of my favorite surgeries because it has such a big impact on the contour of the chest. And you can see this patient has grade 4. And what does that mean? Well, it means that it's got excessively large breasts, but there's also other components. There's too much skin and they're hanging down, and the nipple positions are just way too low. And this guy lost a lot of weight. He lost a total of 80 pounds. And so having gynecomastia and that weight fluctuation eventually leads to this kind of low breast position. And so just doing traditional gynecomastia techniques like lipo and cutting out the tissue is not going to address the two other major things, which is the extra skin and the nipple position. And you can see he actually has a pec definition up here, but how much lower this nipple is compared to where it should be, which is up here. And there's a concept I want to talk to you guys too about breast footprint. He's got a relatively low breast footprint. And what does that mean? For me, that means where the breast comes off the body. Some guys, their breasts come up off higher, some in the middle, and his comes down a little bit lower. You can see where the takeoff of the breast is. Some of that dictates where the final scar is, but the goal of this surgery is more for contouring. And so my plan of attack is to make an incision around here, get all of this out, get the side stuff out too, because he's got some excess here, and then make the areolas much smaller. You can see how large these areolas are. It would not be the right size for a flatter chest. So I'm gonna make the areolas smaller, take them off, and then sew them up at a higher position, in a more appropriate position relative to his pec muscle. So he's gonna have a really tight contour. And that incision is the only drawback, I would say, but they do tend to heal really well. But that incision does run kind of like this pattern like here. But that's the trade-off when you've had gyno for so long and that weight fluctuation. Another thing to highlight is he's got a little extra fullness here compared to this side, and so I'm going to do some lipo here just to kind of bring that down, because even when I pull this down, I don't like how full that is, and it's going to be a little asymmetric compared to this other side. But I'm going to do my markings. I love doing these surgeries because these guys do all the hard work losing the weight. I'm here just doing the finishing carpentry. So I'll get started with the markings, then we'll head back to the operating room. So we're here in the operating room. He's laying down, and I've done my markings. You can see I've already done my areola marking. So I'm gonna make his areola significantly smaller than what his native areola is. But the plan really is to cut along these areas, close, and you can see when I close how much that tightens everything up here, and then close that all the way, and then put the nipple back up in a normal position. Now, what I normally do is I start on the bottom. I don't commit to this line until I know I can get that out, and sometimes I have to make an adjustment and bring it down. And then the other thing is, I'm stopping the incision here, but with these guys who've lost a lot of weight, they have a lot of overall skin laxity, so I always have to be prepared to connect the incisions or to carry it a little bit farther to make sure that there's no pooch or dog ear in the middle of the chest. So I'm going to start though on this side by doing a little lipo of this armpit area, but then start with the mastectomy. finished the mastectomy on this side. I'm closing the deepest of the 3 layers that I closed with. But you can already see like how much tighter this skin is. Like I can't even grab it. It's very nice and tight. When these other layers come, it'll be even better, as opposed to here, how kind of loose this is. And it looks like he's not going to need any connection to the midline. This actually looks like it's laying down pretty flat, which is awesome. But I'm just going to finish closing this and then do the mastectomy on this side and then put the nipples on. Here doing the nipple areolar grafts, I've already thinned out the left side, and this is the right side I haven't thinned out. And you can see the difference now. This is way too thick. If I just sewed this graft onto the chest, it wouldn't survive, because the way these grafts work is the blood supply has to come from his body into the skin of the areola on the underside to be able to keep it alive. But if there's all this tissue blocking it, it's not going to get to the skin. So what you have to do is thin it out to something like this, and that ensures that the blood vessel will get into it and keep it alive. So I got to just thin this one out, and then we'll sew it on. So just finished this grade 4 gynecomastia surgery with double mastectomy and free nipple areolar grafts. He's sitting about 50 degrees up, and you can see the significantly better contour. You can see the incisions are nice and symmetric. I want to show you one thing. The nipples before surgery, I marked them. This is how low they were, and now this is where they are. So I measured this was about 11.5 centimeters, or about 5 inches higher than where they were before. But now they're nicely balanced on his pec muscle. And the incision had to be carried out to here to get rid of all the extra skin, so he didn't have any dog ears. Thankfully, I was able to close this in a way that it closed nicely and didn't have to connect the incisions in the middle. But his contour now is so much better. It's tighter. It matches the rest of his frame. And yeah, the incisions, they'll take a little bit of time to heal, but they tend to heal very nicely. But again, did a double mastectomy. It ended up weighing combined about 3 pounds. So the tissue doesn't weigh a lot, but you can see what it does to the contour. And this is the only surgery that can be done for guys with severe grade 4 gynecomastia. And I also did the liposuction of the right armpit area to get a better transition. It took out about 150 cc's, or about a 1/4 pound of fat in that area to help with the contouring in that chest. It's a big surgery, big result. He's going to do great. Till next time, guys.